Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate can be sure of happy heart. Today we have Dr. Parijat Chowdhary, MBBS, MD, DNB, consultant, interventional cardiologist, Medithics Clinic and AMRI Hospital, Kolkata. How do we define hypertension and when should we conclude that the person has hypertension?
So hypertension, is a very important condition because hypertension is very prevalent, one of the most common cause of morbidity and mortality among young Indians and also elderly. And hypertension is also the most important cause of associated heart disease. We call it hypertension when blood pressure is more than 140 by 90 millimeter of mercury, when systolic BP is more than 140 and diastolic BP is more than 90. Hypertension is usually a silent disorder because initially there might not be any symptoms of hypertension, but slowly with the time when the patient has some side effect associated with hypertension, they might come with complications. So hypertension means when the blood pressure is more than the expected value, that is 140 by 90 millimeter of mercury.
Can high blood pressure be completely cured?
Again, hypertension is not completely curable. It is a chronic heart disorder. Hypertension when happens, it says that the pressure exerted by blood on the wall of the arteries are more, and it can be two types. One is essential hypertension, other one is secondary hypertension. Essential hypertension means when there is no associated cause and there is idiopathic hypertension. It might be genetic. Most of the cases essential hypertension is genetic, and secondary hypertension when there is associated condition which leads to hypertension, like if the patient has associated kidney disease or heart problem or associated hormonal imbalance, or there are many other conditions. With lifestyle modification, with proper exercise and dietary practice, we can of course reduce the dose of antihypertensive medicine, but because it is a chronic disorder, it might not be able to stop it completely.
Has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Recently, we have seen that there is a huge increase in heart attack and hypertension among younger individuals in India. The cause of increased hypertension in younger population is multifactorial. Mostly it is due to because nowadays the food habit is very different and the young adults are consuming on more the junk food, and there is also lack of activities, and because of lack of exercise and consumption of more fatty and high salty food, there is increase in weight. So obesity and the lack of exercise and the unhealthy diet, these are very important cause of hypertension in younger generation.
Thank you, doctor, for your time.